Nordisk India on Tuesday slashed the prices of its anti-obesity injection Wegovy by almost 37%, bringing the prices down from rupees 4,700 to rupees 2,300 per week for its starting dose. Now, what's the strategy behind the decision? I have with me Vikrant Shrotiya, Managing Director, Novo Nordisk India. Thank you, Vikrant, for joining us. Vikrant, what prompted Novo Nordisk to bring down the prices of Wegovy in India? Is this the evolving competition specifically from Eli Lilly's Mounjaro, which has now become India's top-selling drug as well?
Thank you very much, Himani, for having me here. And I think, one can weave around many of the stories around this price cut. But the price cut in the pharma industry is not new. These are the price cuts which have been there for many of the medications. In fact, even in Novo Nordisk history, you see we had earlier cut the prices of our insulins. 5 years back, we cut the prices of our new generation insulin. And we have seen that when we cut the prices, bring it into an accessible zone, more and more patients can have the benefit of these drugs. And similarly, when we launched, and it's not long back, just 4 months before when we launched, it was launched with a broader and a larger strategy keeping in mind. First task was to bring the innovation, and then my second task, being an Indian in a multinational company, is also to bring the accessibility of these medications. So I don't think so it has something to do with the competition, but it has something to do with the patients. When you look at 250,000 million patients, and by and large, 100,000 patients plus minus would have taken these medications. It's nothing. It's not even tip of the iceberg. I think the reach of these medications which is required is by far much more higher. So when we bring down the prices from 17,000 plus to 10,000 range, 37%, it's a lot of shaving which we do in our top line. But we do it for our purpose. We do it for our commitment. We do it for accessibility. We do it for make it available for large number of patients, because when we see that so much of obesity is there, okay, we would like to see many more patients get the benefit of these drugs. And that's one of the reasons why we have launched and why we have cut these prices. Rest is, I would say, figment of imagination.
I'll come back to Wegovy, but I'll ask the question which everyone wants to ask you. Are you planning to bring Ozempic to India anytime soon?
Ozempic has just got the regulatory approval from the authorities. So, of course, it's in our plan to launch it in India. But you are aware that Ozempic is actually for type 2 diabetes, and then Wegovy is for obesity. And that's the reason we would like to bring Ozempic also to India.
So at the regulatory stage of approvals, it has been approved by CDSCO. That's what you mean?
Fantastic. Yes, it has been just approved by the CDSCO. So we are just planning the various themes of the logistics to make it available in India.
And do you see any challenges to bring Ozempic to India when you plan about the logistics and other things?
No. And fortunately, we have got now uninterrupted supply and a commitment to supply to India for the demand which India can pose. So we are ready, and we are just buoyant and looking forward to these launches in India, because they would serve the need for the patients. You have 100 million diabetes population, and then you have 250 million obese population. And then there is an overplay of these diabetes and obesity. Like people with diabetes have obesity, people with obesity have diabetes, they have cardiovascular disease, they have the fatty liver. I think this entire interplay, and in this interplay, the relevance of GLP-1, I'm sure our stakeholder know about it. We would just love that more and more patients also get the benefit of these drugs. So this price cut of 37% is actually a step in that direction.
Vikrant, Novo Nordisk is an old player in India, and by now you will know that how much time the company takes after getting the regulatory approvals. So by when you think that you will be able to roll out Ozempic in Indian market, estimate?
Yeah, I mean, normally a launch after the approval is somewhere in the time frame from 3 to 6 months. So, but there are no set timelines at this point of a time. What we have really requested is the process out there so that we can get it from our production facility in Denmark, products in India. I would use the word which is 4 alphabet ASAP, as soon as possible.
So you will be importing Ozempic from your Denmark facility to India as of now?
Absolutely.
If I'm right, the product is losing its patent in March.
Yeah,
So you
absolutely.
would like to launch it before that?
That would be a try if we can launch before the expiry of the patent. Anybody, any business person would do like to do that. But then we are not only driven by the LOE, we are also driven by our purpose, our commitment, our drive, patient centricity. And I think that is something which is very, very important. And given that Ozempic has been there in international market for more than a decade with semaglutide overall 33 million years of experience, I think it would be quite a good trust and reliability for many of the patients across and the doctors when Ozempic comes on Indian soil. So we look forward to that. But I think LOE is just an incident in the life cycle of the innovation journey.
Right. Vikrant, how do you see this market for anti-obesity drugs evolving in India? This is becoming a big, big category.
Now you can actually see when we are not even scratch. I don't even say, and I really mean it, it's not even the tip of the iceberg which has been done in the last 7 8 months. It is multiplying. So imagine a situation when more and more patients started getting accessibility, and specifically with the prices which we have just now unfolded for the patients. I think it will multiply quite a lot. And with this kind of a multiplication, the byproduct will be commercial outcome, but I would love that more and more patients should get this benefit. And at least we can bend the curve like the way in US. If you have seen the recent data, recently US could able to bend the curve of obesity thanks to these GLP-1, and we would like to achieve the same. And in that journey, we would like to be in the pole position to do that.
Right, right. Obesity is often under-recognized as a chronic health condition. How Novo Nordisk is working on changing the narrative from the cosmetic changes or the drugs for cosmetic purposes to the drugs to handle the chronic weight management. Are you working on something to change the narrative?
Yeah, and you can see that that world over, many of the authorities, many of the governments have recognized obesity as a disease. And not only as a disease, there are a lot of adjectives which are there. It's a progressive, relapsing disease. So it's like you can say ping pong kind of a ball. You lose weight, and then everything is against you. You regain the weight. The issue is, I have a very big task that people who have obesity and morbid obesity and concomitant illnesses, they are not taking these medications. I think we have a large task to create that awareness that obesity is a big problem. It's actually the epicenter of 230 disease. We need to tackle it. Then there is another task which we have got, that people who take it for cosmetic reasons, they should not take. And I think we strongly advocate that people should not self medicate. They should go to the right doctor if they need the medication, and they should evaluate it carefully and then take these medication.
Right. Vikrant, so far in your journey with Wegovy in India, what are your observations? Have you noticed a patient's journey? For instance, if I start the Wegovy dose today, what will be my journey like? What are the side effects, or what are the otherwise effects that I will face when I start consuming this drug?
One of the consumer insights which we have got is, come what may, patients want to have a quick weight loss. And even with these medications, there is nothing called quick fix, right? You need to be committed towards reducing your weight. It should be one of the things which you should dedicate yourself. So, of course, medication will help. Now, when you take these GLP-1 medication, people think of a scenario that they take a medication and it's an excuse drug. They can do anything, and then they can take medication and it can resolve the issue of the obesity. The fact is that it tackles the disease and a disorder in a very steady and, you can say, sustainable way, specifically semaglutide. It's steady and sustainable in terms of a weight reduction, and not only weight reduction, but also benefit many of the, we call it pleiotropic benefits, the benefits of the heart, the benefits of many other parameters which actually getting much more better with these drugs. Of course, when patients take, they can have a small side effect. We call it transient, and they are in the journey. They remain for 10-15 days in terms of nausea and vomiting, and after that they subside, over a period of time. And we would like to tell the patients that these these kind of symptoms which come, you have to stay true to the drug, true to the advice of your doctors, and remain committed for the weight loss. And when you couple it with diet and exercise, these medications, and also with the advice of your doctor, you will see the weight loss will be very steady and sustainable.
Right. With the Wegovy already in India and Ozempic joining Wegovy soon, are there any other drugs on cards that Novo Nordisk intends to bring in India to handle the weight management as well as diabetes crisis?
I think we are committed to bring all the innovations, and I would love that further weight loss medications in more convenient way, much more effective if they come from our laboratories. And I think scientists of ours, we are also investing billions of dollars to make that possible. And I would like to see a day that if we can have some kind of a treatment coming which can really reduce the weight in a very easy and sustainable way. And there are many of the molecules in our pipeline, which our scientists are working. Oral sema is actually one of the medications which is just you can say in the pipeline. Then we have got CagriSema, which is also there in the pipeline. So many of the other molecules in the research pipeline which are there. So I think this therapy area remains to be active for years together. I think it's a good power play over a next decade.
So in the coming years, we are going to see these medicines available in the oral pill format as well as with the much reasonable pricings as well, right?
I would say the oral solutions for obesity is quite in an advanced stage in terms of getting into the reality. But pricing I cannot comment, because there are many other parameters which go into the global pricing and as well as in the local pricing.
Thank you so much for this piece of information, Vikrant. Thank you so much for your time.
Thank you very much. Thanks a lot, Himani.
Been fighting so long and so hard that they don't know what the they're doing.